anything's gonna happen. Even if something does happen, you'll all be fine, as in massive amounts of turbulence, you'll be fine. I could not get that into my head. And my husband was with me, and he was very calm and patient, thank God. And he was like, even if there's the worst turbulence, we'll be fine. And the flight attendant who saw me being sick as I'm walking to the bathroom was like, look, you know, there's going to be a lot of turbulence. You need to get your seatbelt on. And she's like holding on to the side for dear life, which of course aggravates my anxiety. And now, if she's not calm, shit's really going down, right? I mean, you look for the flight attendants to be calm. And she wasn't not calm, but that was terrible English. She was calm, but she was also holding on to the side door, you know? And I was just terrified of what happens if something happens to me, you know? I lost it. Couldn't control my fear. So this morning, which wasn't planned but worked out well, I went to go see my private doctor, GP rather, that's what I'm trying to say, because I had been worried about the fact that my memory's been so bad lately, I can't remember things. But obviously that is in line with anxiety. A lot's been happening lately between the theft and, the robbery and things in the family and normal shit. It's overwhelming, and that affects the prefrontal cortex, so obviously that affects your memory. And I know this, but I just wanted to rule out anything medical. I see a therapist. Therapists need therapists. Everyone needs therapists. And I wanted to just rule out anything medical, because that's the first thing you have to do when you're treating someone anyway. You know, and he's like, yeah, it sounds like you have generalized anxiety disorder, which I don't know how I feel about that quick of a diagnosis. But obviously, if anxiety is impairing your life, me being around a toilet for 3 hours feels like an impairment, then yes, okay, that's a fair diagnosis. But then he suggested I take anti-anxiety meds, like Lexapro, low dose of Lexapro. I treat those whom take antipsychotics, anti-anxiety, antidepressants, SSRIs, blah, blah. And I don't want that for myself. I respect people's choices. They can take the meds, whatever they need to do. But I personally don't like medication. There's no known mechanism of action in any of these drugs. So for me, I don't want to be treated with them. And he's like, okay, talk to your therapist about that, but you're obviously under an overwhelming amount of stress right now, and it might be a good idea to alleviate some of that burden so that, you can live. And to me, it's like, great. Like, let's take some pills and feel better, but how does that actually resolve anything? Like, I need to know what my triggers are and how I can cope